Welcome to today's Nursing Mentor podcast. In the next 2 minutes, we're focusing on preventing catheter-associated urinary tract infections CAUTI and surgical site infections SSI. These are common hospital-acquired infections that can lead to serious complications, but they are preventable through adherence to evidence-based practices. Let's walk through the essential steps in preventing these infections before and after catheter insertion. These are life-threatening complications that can be mitigated by following proven protocols. Let's dive into the essential preventive steps. First, let's talk about CAUTI. The primary cause of urinary tract infections in hospitalized patients is the indwelling catheter. Preventing CAUTI begins with sterile technique during catheter insertion. Healthcare professionals must ensure that the insertion site is properly prepared by performing thorough antiseptic cleansing of the urethral meatus and surrounding skin, using an appropriate antimicrobial agent to minimize bacterial colonization. Before inserting the catheter, it's crucial to verify the necessity of the catheter. Indwelling catheters should only be used when absolutely necessary and for the shortest duration possible. Once inserted, secure the catheter to prevent movement, which could cause urethral trauma or discomfort. Post-insertion, the focus shifts to maintaining a closed drainage system. The catheter must be kept free from kinking or obstruction, and the collection bag should always be placed below the level of the bladder to avoid retrograde flow of urine, which can introduce pathogens. Routine monitoring of the insertion site is essential to detect any signs of infection, such as erythema, swelling, or tenderness. Now, let's shift to surgical site infections, SSI. Preventing SSI starts long before the surgical incision is made. Preoperative antiseptic preparation is crucial, including the use of Chlorhexidine Gluconate or iodine-based solutions to cleanse the skin and reduce bacterial load. Administering prophylactic antibiotics within 1 hour before incision further reduces the risk. After surgery, proper wound care is essential to avoid infection. This includes sterile dressing changes and avoiding contamination of the surgical site. Postoperative monitoring for signs of infection, such as increased redness, discharge, or fever, is critical for early intervention. In summary, preventing CAUTI and SSI requires strict adherence to sterile techniques. Maintaining a closed system, minimizing catheter use, and ensuring proper wound care. By following these evidence-based practices, we can significantly reduce the risk of these hospital-acquired infections, ensuring better outcomes for our patients. Thank you for tuning in. Stay safe and join us for more healthcare insights in our next episode. Stop the video and check the new vocabularies in the description.